Hello all, this is Dr. Timani, and in the spirit of fillers, we're going to be talking based upon my patient's requests about the cannula today. I know that many of you are coming in asking for the cannula technique, but I wanted to say that the cannula is an amazing needle that is pretty much the standard of care for many techniques, especially the advanced technique. Now, what is the cannula exactly? It's a needle, but it's a blunt needle with a blunt tip. The advantage of which is that it is not as traumatizing to the tissue and the blood vessels. And I'll tell you why in a second. Needles still have their place, of course. Everything has its place in the right hands with the right technique. Gigi, if you can come up closer to me here, I would like to show you all the cannula. It is a long needle. This one is 1.5 inches. It looks intimidating, but of course it's not. There are actually much longer cannulas too. But the key feature is that the tip is not sharp, it is blunt. I hope you appreciate this. You're probably all wondering, how does this ever get into my skin? And let me show you how that is possible. We have a little introducer here. This is, as you can see, a sharp needle, and what we do is that we pinch the skin with this sharp needle, and this would probably be the only time you feel any major discomfort, after which we create a little tract and we introduce the cannula into the tract. So essentially the advantage of a cannula is that it creates less bruising, less swelling, and it allows the injector to place the filler in the adequate plane. It is really hard to push the filler in the wrong plane when you're skilled with cannulas, so the cosmetic outcome is great. But mainly today I want to say the key feature of cannulas is that they are safer than needles with respect to blood vessels. A needle can hurt a blood vessel, can nick a blood vessel, and accidental lodging of a filler in a blood vessel can have a bad outcome. And there are rare cases in the literature of these cases and rare statistics, but they do exist. So what the cannula does is that it just pretty much pushes away a blood vessel, and worst case, if it cuts through the blood vessel, it goes through and through, and it definitely minimizes the chances of a vascular event. Now, all of this sounds very technical, and yes, it is technical. And this brings me to a very important point. How do you seek a professional? Who's the ideal professional to be your injector? First and foremost, you want somebody that you are confident with, that you trust, and you want somebody to sit down with you and listen to your needs, because your needs are the most important. You want somebody to listen to your expectations as well, because they are very important too. But you also need somebody to set expectations for you. There are limitations to all cosmetic procedures, and there's pros and cons to all cosmetic procedures as well. So I tell my patients, if you go somewhere and they tell you that there's no risk to a procedure, you better run away. That's not the right place for you. And in general, my approach to fillers is taking my time. I really like to block long visits. I like to talk to my patients at the visit and re-educate again. I like to take my time appreciating their face. I really like to take my time with the injections as well. And even though there's a lot of science in injections of fillers, it is an art as well. So like I said, you don't want to be that statistic, and you want to minimize the chance of being that statistic. Thank you all for your attention, and I can't wait next time to show you how the cannula is introduced into the skin and how the filler is injected, and that's my project next time. Thank you all. Bye.